Let's sanitize our hands.
Okay.
Mayank Buntam sir.
Mayanguntonda.
Akosi Vishal, second year medical student of the Medical School Foundation, and I am here to take your breast and axilla examination. For this examination, I need to ask few questions like related to your name and all. Like I will take the identifying data. Is it okay if I start
Yeah.
with this?
Okay.
Unsay mong pangalan sir?
Yash.
Pilay mong edad?
25.
25. Okay. Unsay mong trabaho?
Student.
Unsay mong religion?
Hindu.
And asa ka na kuyo?
Kasaliga.
Cassidy. Okay. Then the importance of this examination is like I will get the diagnosis of any lumps, lesions, or any discharges there. Then any retraction of the nipple or supernumerary nipple. Like this kind of diagnosis we will get from this. And I told the importance. And then what are the steps in this examination? Like I will go with the inspection and palpation of the breast, and then I will proceed with the inspection and palpation of the axilla. In the palpation of the breast, I will go with the lateral portion palpation and medial portion palpation in two different positions. And then, is it okay if we start with the examination? And if any female patient is there, we need the female companion for this, or else for the male we can proceed with the examination. Should I proceed with the examination?
Yeah.
Okay. You have to remove your T-shirt. Can you? So we will start the examination like inspection of the breast. For this, patient have to sit like arms at the sides, and so that I will start the examination. So I will be checking for any lumps or any lesions or any discharge over your nipples. So I can't see any lesion or discharge over your nipples. So the next will be the size of the size, then symmetry, then shape and contour or any skin color change. There is no change in the color, or the symmetry is normal, and there are no any retractions or any abnormal retraction or inversion or eversion of the nipples, and I can't find any supernumerary nipples over your breast. And then there is no retractions or anything is seen over here. And then I saw the texture, and then I can see the venous pattern is also good, and then there are no lesions over your breast. Is it okay if I start with the palpation of the breast?
Okay.
Okay, I am wearing the gloves and I will start the palpation of the breast. For this I will start like we have to lie in the supine position. So can you lie? Okay. For this examination, you have to roll your hips to that side, left side. Okay. And I will keep this pillow just below your shoulders. Okay. And you have to keep your and you have to keep your hand over your forehead. I think I need other pillow. Just one minute. Okay. Just press it against here and just roll your hips. Okay. And I will start with the lateral portion breast examination, and for this I'll follow the vertical strip method. And for this examination I'll use my 3 fingers, like second, third and fourth finger, and I'll follow the vertical strip pattern for this. So I'll go with the light, medium and deep pressures. So you have to tell whether you feel the pain or anything.
Okay.
And I'll check for the nodules or any lumps or the masses. Do you have any pain?
No.
So I'll go up to the bra line, and then I'll go up again. I will follow the vertical strip pattern up to the clavicle. Okay. No pain?
No.
Okay. Okay. I can't see any nodules or lumps over your breast. So we will start with the medial portion of the breast examination. For this we don't need this pillow. You have to just lie down in supine position, and then I will just palpate for the medial portion of the breast. I will start the palpating. feel any pain?
No.
Do you feel any pain?
No.
Okay. 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 You can sit now. While doing the palpation of the breast, I can't find any abnormal retraction or any lumps or lesions or anything. And the next step is compression of the nipple and areola that I forgot. So sorry, you have to lie down again so that I will check it again. So I will compress the nipple and areola to check any discharge over your nipples. So I can't find any discharge over your nipples. Then I will check for the another side. Okay, there is no discharge here also. Okay, you can get up. So I did the palpation of the breast also. While I was doing the inspection of your breast, I forgot to do the re-inspection. For this, you have to do the few steps, like you have to keep your hands over your back of your head. While doing this, we can see the distribution of the breast tissues, and I can able to see like if any retraction or anything is there. So there is no retraction or any lumps or lesions over your breast. So the next step will be you have to keep your hands over your hips. So in this case also I can't see any retractions or anything over your breast. And the third step is like you have to lean forward like this. Okay. I can't find anything like abnormalities like mass, lumps or lesions or anything. Okay. So we are done with the examination, like inspection and palpation of the breast. So we will proceed with the inspection of the axilla. For the inspection of the axilla, you have to get your arm, and I will check for the any infection, rash or change in the color. So there is no rash or infection or any change in color I noted. And for the then we are done with the inspection of the axilla. So I will proceed with the palpation of the axilla. So I will palpate your right side, your left side, and I will hold this with my left hand, and I will palpate with my right hand. So in the palpation, I will palpate the inner arm, then chest wall, and then anterior portion, that is pectoral, and posteriorly so subscapular area. So I will palpate for the any anything in the axilla. Okay. Can't find anything abnormal here. So at the back. Okay. For the pectoral. Okay. Then I have to do the palpation of the supraclavicular and infraclavicular also area. Okay. There are no swelling or any lesions over your axilla and supraclavicular area and infraclavicular area. So I did the inspection and palpation of the breast and axilla also. I can't find any abnormalities. Do you have any further questions?
No.
Okay. While doing this all the examination, I didn't see any retraction or any mass or lesions or any discharge through your nipples, and there are no abnormalities in the axilla area also, like any infection, rash or change in the color. After we are done with the examination, if you don't have any questions, you can wear your t-shirt. As we did the examination, you are perfectly fine. We did this examination because in case you have any like abnormalities, we will get the early diagnosis of this. Okay, thank you.
Thank you.